Tell us just why you're undergoing this ovarian freezing, in your own words.
I was diagnosed with severe aplastic anemia 3.5 years ago when I was only 25. And I've been married for almost a year and a half now, and we desperately want children. And my doctors are searching for a bone marrow donor for me right now, and I know that having a transplant kills all of your eggs. So we are ensuring that we can hopefully have a baby someday, and it will give me major peace of mind and just make us feel better in every way, because we really want a family.
Well, I think that really explains it. When you first, actually, I only understand, you had an autoimmune disease when you were younger, right? Scleroderma, could you tell us about
Yeah,
that?
when I was 18 at college, that came about. I got tingly hands, and the skin on my arms kind of discolored and just got weird. And it was kind of in my knees, just various joints. And so I started to see a rheumatologist for that. Did various medications for maybe 5 or 6 years.
You diagnosed scleroderma, right?
Yeah.
Okay.
And, it was pretty bad at first, but it just kind of fizzled. It just kind of went away. And it hasn't really bothered me in a number of years.
So that was an autoimmune disease that's really responded to simple immunotherapy then, really?
Yeah.
You didn't need anything drastic like a bone
No,
marrow
not
transplant.
at all.
So then I guess it shocked you when several years later, I guess at age 25, you came down with aplastic anemia.
Yes.
Yeah. How did you find out you had this?
I was having 2-hour nosebleeds,
Oh.
which I've always had nosebleeds, and I knew that was weird. So I went to my regular doctor. They gave me nose spray, and I went home and I thought, this isn't right. So I called my rheumatologist, and she did lab work on me and said, you need to be in the hospital right now. You shouldn't even be standing up. Your counts are so low.
So your rheumatologist was very sharp and made the diagnosis.
Yes.
This is one problem. Sometimes the primary care doctors will miss these things because they're tricky and they're not that common. But
Yeah.
luckily, you had the wisdom to call your rheumatologist.
Mm-hmm.
And so you've been struggling with this for 3 years, 3.5
Yes.
years. Declining blood counts, declining platelet counts.
Yes.
Tell us your understanding of what causes this aplastic anemia.
No idea.
Okay.
I've heard that various things can cause it, like being next to chemical plants and different drugs that you take can cause it, and being pregnant can cause it, but they have no idea what caused it in me.
Yeah, it's probably, autoimmune. You have the scleroderma, which is autoimmune.
Yeah.
So it's probably your white blood cells are actually killing your other white blood cells and killing the rest of your bone marrow because they're immune. They're recognizing your bone marrow as a foreign object or a foreign body. So it's kind of like an autoimmune or auto-rejection.
Mm-hmm.
You know. So there is curative treatment, as you know, and it works extraordinarily well in terms of a bone marrow transplant or a stem cell transplant. And that's what you think you're going to have pretty soon.
Yes.
Okay. And understand they had found a couple of perfect matches for you in the past, but you weren't ready for it yet, or.
Yeah. When I first got sick, they searched right away just in case, but they tried other treatments with me, and just recently they searched again because my counts are so bad, and they found the same 2 donors are still there, 2 perfect
great.
10 matched donors.
Oh, that's great. That's great. Well, it's a smart thing, though, that you didn't have the bone marrow transplant earlier because you didn't know about being able to preserve your fertility.
Right.
I mean, obviously your rheumatologists, your oncologists are really smart. I know they're amongst the best in the country. I happen to know that. But they didn't warn you that you could preserve your fertility. Is that right?
Now, I read about it. When I got sick, I started reading all about aplastic anemia and transplants, and I found it online first that you can do that.
So that's the reason for this interview, is because you're like one of many people that are going to benefit from this incredible modern science of bone marrow transplants. It's curing young cancer patients that previously had a absolutely fatal disease that there was no chance of cure for, and they're curing people with aplastic anemia and multiple sclerosis and scleroderma. You had a mild scleroderma, but some
Yes.
of them are life-threatening. And it's a remarkable, but of course that kills the ovary and your eggs and makes you sterile. And there's no awareness unless the patient searches for herself that we can preserve her fertility. Is that right?
Yes. Even when I first got sick, when they decided not to do the transplant right away, one of the first things I asked was, "Can I still have a baby?" And they said, "Yeah, you should be fine to have a baby." And then 2 months ago, my husband and I went to see a high-risk pregnancy doctor, and she said, "Don't get pregnant." She said, "You should not have a baby. You're too sick. It'll do all sorts of terrible things." And so that's made me
Yeah, that was Dr.
pursue
Moore,
this
right?
more. Yes.
Yeah. So she gave you the greatest advice because it would have been too dangerous to get pregnant in your condition.
Yeah.
But you don't want to have babies, so
Yeah.
we'll take out your ovary. We'll preserve your fertility that way, and then when you're ready to have babies, we can transplant it back.
That sounds perfect.
So I appreciate your being willing to tell other people about this.
Anything to help other people. Being sick is awful.
It is
awful
awful.
in every way, and anything that can help, I'm ready to do.
You're helping tremendously. The awareness of it will help them. And I appreciate it, and you're very brave, and I can assure you you're going to come through this just fine and have a big family.
Okay, thank you.